Hello, everyone. Thank you for joining the presentation. My name is Bill Bjerke. I'm from Fallon Health, which is a healthcare services organization that offers Medicare and Medicaid plans for a variety of ages, incomes, and health conditions. I'm here today to talk with you about Fallon Health's Fallon Medicare Plus Medicare Advantage plan options. Fallon Health is a healthcare services organization that was founded in 1977. And has been providing Medicare coverage for more than 40 years. We are dedicated to our mission, making our communities healthy, and we offer innovative health insurance solutions to support the diverse and changing needs of those we serve. During today's meeting, I will discuss Medicare basics, the Fallon Medicare Plus service area, the benefit bank, your plan options, Fallon Medicare Plus benefits and copayments, and how to join. Let's talk a little about Medicare. Medicare has four parts. Part A is known as hospital insurance. Part B is medical insurance. Part C are the Medicare Advantage plans. Part D are the Medicare prescription drug plans. When you become eligible for Medicare, you can choose the way you receive your coverage. Medicare consists of the different parts, and each part provides different coverage. So it's important to think about the type of coverage you may want or need now and in the future. Now let's take a quick look at this particular slide. At the top, you see basic coverage. That's also known as Original Medicare. Now with Original Medicare, you have basically 80% coverage by Medicare. There are some deductibles. For instance, the hospitalization deductible is $1,484. The Part B is the medical services, and that has an annual deductible of $203. So what that means with Original Care only, you will have 80% coverage, you'll have deductibles, and you'll be responsible for 20% of the insurance. Now, what people do to enhance that basic coverage is to select a Medigap or a Medicare supplement plan and also purchase a Part D prescription drug plan. That will help pick up some of the costs for the deductibles, depending on the type of plan that you select, and also provide prescription drug coverage. Other people may want to pick up a Part C plan, which is the Medicare Advantage plans. These are private insurance policies that are provided by insurance companies like Fallon, and they will provide you with the benefits that are covered under Parts A and B. And they may come with or without prescription drug coverage. If you decide that you want more coverage than what's provided by Original Medicare alone, you have some options. So if you do select to go with the Medicare supplement Medigap plan, you may also be eligible to receive additional benefits that cover the out-of-pocket expense not covered by Medicare, and also include vision care, money for eyewear, gym memberships, and more. And of course, with the Part D plans, you'll have coverage for your prescription drugs. Now, on the right-hand side of this page, we see the Medicare Advantage plans. All of the benefits with Original Medicare are covered, and you'll receive additional benefits, which may include vision care, dental services, hearing aids, gym memberships, eyewear benefits, and more, and most do include prescription drug coverage. The Fallon Medicare Plus service area includes all of Massachusetts except Dukes and Nantucket counties. Let's talk about the benefit bank. With the benefit bank, you get a card that has up to $500 per year to pay for fitness memberships, dental services, eyewear, and starting this year, hearing aids. The annual amount that you receive depends on which of the Fallon Medicare Plus plans you choose. You can use the card for one item or service or a combination at your choice. And I'll review the benefit bank amounts on the next slide. Now, with Fallon Medicare Plus, you have choice of 3 plan options: orange, green, and blue. So it doesn't matter where you live in the state, if you're enrolled in the Fallon Medicare Plus HMO plan, as to what your coverage is going to be. So we first look at the orange plan. So look at the county in which you live, and this is our lowest cost plan. Some counties have a 0 monthly premium, and in the Barnstable and Berkshire area, it is a $29 premium, and all of those counties provide for a $500 benefit bank, and there's no medical deductible on any of the orange plans. Next is the green plan. This is our mid-range plan. Again, check your county. The rates are listed: 67, 89, and 114. The benefit bank on all green plans is $250. Next is the blue plan. This is our higher cost plan, and you'll see in a moment how the benefits do vary between the different plans. The cost for the blue plan is $116, $180, or $227, depending on the county in which you live. And again, there is no annual medical deductible. Now, this chart lists some of the great benefits that you receive with the Fallon Medicare Plus plan. So we look at the orange plan first, and you see that the annual physical and wellness visits have no copayment. The primary care office visit is $10. Specialist visit is $40. And this year we're introducing the teledoc, or the telehealth services. Primary care services, outpatient mental health and substance abuse are covered at a $0 copayment, and a $40 charge for a specialist by the teledoc services. Again, those are for non-emergency services. The ambulance copayment is $300. The inpatient hospitalization is $370 per day, up to the first 5 days. So a 5-day hospital stay on this plan could be $1,850. Next, we see diagnostic services. All of our plans provide no charge for the lab and x-rays that you may be required or need to have. Next, diagnostic imaging. These are the CAT scans, MRIs, the PET studies, and other nuclear studies have a $300 copayment requirement. The outpatient surgery is $350. The best example of that might be something like cataract surgery. Next is the worldwide emergency room visits, and that is a $90 copayment on the orange plan. If you're in the United States and can utilize an urgent care facility, that is covered with a $10 copayment, and worldwide urgent and emergency services are going to be $90 on the orange plan. The Silver Sneaker gym membership is not included on the orange plan. Prescription drug coverage is covered, and we will see that breakdown in just another couple of minutes on another slide. Next on this slide is the green plan. This plan has no charge for the annual physical or the wellness visit. There's a $25 copayment for the primary care office visit, and a $40 charge for specialists. The teledoc services are no charge for the primary care or mental health or substance abuse, and there is a $40 specialist copayment if you utilize the teledoc services. Next, we see the ambulance services, $225 copayment, and a maximum 4 times per year would you pay for ambulance transportation. Next is the inpatient hospitalization charge. This is a $300 per day charge, so your maximum hospital cost will be $1,500 on the green plan. As mentioned, the outpatient lab tests and x-rays are going to be at no charge. The diagnostic imaging is a little less than the orange plan at $250, and a maximum of 4 times per year would you pay for those particular services. I would like to point out that any procedures that are done while you are hospitalized are covered under the per day hospital charges. There are no additional charges for things like MRIs or CAT scans you may receive while a hospital patient. Next is the outpatient surgery. $275 for that procedure. Worldwide emergency visits are at $90. The urgent care is $25 for any place in the United States and $90 worldwide. This program does include the Silver Sneaker program, which is a national association of over 14,000 locations, so you can utilize the Silver Sneaker benefit that is on the Green Plan. And prescription drugs are also covered as a Green Plan member. Next, we see the Blue Plan that has a no charge for the annual physical or the wellness visit. The primary care office visit is covered at $10, and the specialists are $20 on this particular plan. The teledoc services are available with no cost for the primary care, the outpatient mental health and substance abuse, and a $20 copayment if you need to contact a specialist. The plan has a $125 cost for ambulance services and a maximum of 4 transportations per year. And I also like to point out that if you're transported between the hospital and a nursing home or nursing home back to a hospital, and they're able to do that in a chair van, you are entitled to a $35 copayment for that service. So there is a difference and some savings if you're able to be transported by a chair van as opposed to an ambulance. Next, we see the inpatient hospitalization, and that is a $200 per admission charge, a maximum of twice per calendar year for your hospitalizations on the Blue Plan. Next are the diagnostic tests, those lab tests and x-rays, again, at no out-of-pocket expense for you. The diagnostic imaging CAT scans and MRIs are at $150 on this Blue Plan, with a maximum of $600 per year. Next is the outpatient surgery. It's a $120 charge for you on the Blue Plan. Worldwide emergency room visits are $120. The urgent care is $10 and $120 out of the country. This plan includes Silver Sneakers and prescription drug coverage. So let's take a look at the prescription drugs. With the prescription drug options, they are available for both retail and mail order. On this slide, we're going to review the Part D prescription drug costs for preferred and standard retail pharmacies. You notice at the top, we have listed that there is a deductible on the orange and green plans of $300 for the tiers 3, 4, and 5. The Blue Plan has no deductible for prescription drugs. So what that means, if you're taking one of the medications that fall under tiers 3, 4, and 5, you will first have to meet the deductible on the orange and green plans before you're eligible to receive the copayment level of the listed pharmacy. Now, our preferred pharmacy network includes places like CVS, Walmart, Stop and Shop, the Big Y, and some independent pharmacies around the state. A standard pharmacy is a place like Walgreens, which is formerly the Rite Aid pharmacy. So you do pay a slight higher copayment for those particular services, and you can receive a 90-day supply at either of those pharmacies. When you use the retail option, you do pay for each month that you do have a prescription. So if it's a 30, 60, or 90, your co-payments are going to be, for instance, on a tier 2 would either be $7, $14, or $21 for the preferred pharmacy, or $12, $24, $36 on a standard pharmacy. So there are some savings that you can appreciate if you utilize the preferred pharmacy network. Now, I'd like to point out that a tier 6 medication has been added, and that includes Shingrix, as well as the treatments, medications that might go along with folks that are receiving opioid addiction treatment program. So there's no charge for those tier 6 medications. Now let's take a look at the mail order program. Now, when you utilize the pharmacy network that's available for the preferred network, it is going to be Caremark is our preferred pharmacy. They would be the folks that would send out your medications for the 90-day supply. You can get them for less days, but basically most people utilize the 90-day supply. And they have the benefit of saving 1 month's copayment by utilizing the 90-day supply at both the preferred and the standard pharmacies, although the rates are slightly different. Now, if you have not used any retail pharmacy at all, the deductible still applies towards the mail order program. So please keep that in mind. So your annual deductible on the orange or green plan, doesn't matter whether it's your retail or the mail order, you will have that requirement for that deductible. Now, the specialty drugs and the Tier 6 medications are only available for 30-day supply. And the specialty drugs basically may be something that's compounded, or it may be something that the doctor wants to try a particular dose and then change it. So that's why they're limited to the 30-day supply. You most likely get those through the retail location. Now, something that's very important to know about prescription drugs, there is something called the coverage gap, and it begins when your yearly cost, that's the amount that you and the insurance company have paid, reach $4,130. And after you enter the coverage gap, you will now pay 25% of the cost for the covered brand and 25% for the covered generic medications until your total costs reach $6,550, which is the end of the coverage gap. Now, not everyone will reach that coverage gap. Now, please keep in mind that during that coverage gap, the insurance company is picking up 75% of the cost while you're paying 25%. Now, next is the catastrophic coverage stage. Now, this is when your annual costs have reached that $6,550 amount, and you will pay 5% or the greater, which is $370 for the generic and preferred, or $920 for all other drugs. So whatever the greater amount is will be your responsibility for your prescription drugs during that catastrophic period. Now, with the Fallon Medicare Plus, you also get benefits like the teledoc services that we've already mentioned that do have the $0 copayment for non-emergency services. And you can speak to them by either telephone, video, or mobile application 24/7 for non-emergency services. All of our plans do include hearing care, includes a supplemental routine exam every year to determine if you do need hearing aids. And there's a copayment for those hearing aids between $695 and $995 through a company called Amplifon, and our customer service department can provide you with a list of the providers in your area that are Amplifon providers. They would be the ones that would be ordering the devices for you. They'd be doing the installation so that they're adjusted properly for you. They also include 2 years of batteries. They're warranted for 3 years, and everyone is eligible for 1 hearing aid per ear per year. And you can use your benefit bank dollars to pay for some of those services if you do want to get the hearing aids. Next is vision care, including exams, and up to $150 allowance towards the eyewear. Now, we do work with a company called iMed, so those are in-network providers, and you'll be eligible to utilize that $150 as a base for paying for your eyewear. And for everyone, you still have some benefit bank dollars that you could use for paying for any additional cost if you are buying eyewear. Again, keep that in mind. It's important because a lot of people aren't able to get glasses for a reasonable price any longer. They have become a fairly expensive item due to the cost of the frames in most cases. And also includes a fitness benefit. So the green and the blue plan include the silver sneaker program that I mentioned briefly previously, and there's no gym membership on the orange plan. So the benefit bank dollars come into play. You could utilize the gym membership at a local gym that you may want to participate in. There's no network as far as restrictions to where you can utilize that gym membership. Again, that benefit bank card is yours to use as you see fit. Next are dental services. There are no dental services on the orange plan, but the green plan does include preventive services such as an exam, x-rays, and cleanings. And for a small copayment of $25 twice per year, you're eligible to have your those basic services provided. And there is a comprehensive list of other items that you can utilize your benefit bank dollars for. And for people that have the orange card, as I mentioned, there's no dental services. So you can go to any dentist you want with the orange benefit bank card and have some basic or some more advanced services. Again, the orange plan does have a $500 benefit that you can utilize for the dental, vision, health club memberships or the hearing aids. We also offer a free 13 consecutive week Weight Watcher program. And we give you free access to a nurse to talk about some symptoms that you may have. And they will help you decide whether you need to go to an emergency room, to an urgent care facility, or maybe continue to try contacting your doctor's office, or might even suggest utilizing the telehealth services. Now it's easy to join the Fallon Health Medicare Plus plan. In order to be eligible, you must be enrolled in Medicare Parts A and B. You must continue to pay your Part B premium if it's not otherwise paid for under Medicaid or by another third party. You must reside in the service area. And you have options on how you want to or may want to enroll. You can go online to fallonhealth.org/Medicare and enroll there. You can enroll through Medicare's online enrollment center at medicare.gov. And you can enroll over the telephone by calling us at 1-888-377-1980. I'll put that up later on in this presentation. And you can fill out the paper form that's included in an enrollment booklet. Enrollment in this plan will automatically end your enrollment in another Medicare Advantage plan or a Medicare prescription drug plan. So if you are enrolled in any of the type of Medicare health plan, including a Medicare supplement plan, you'll need to notify them that you want to disenroll prior to the effective date of your enrollment into the Medicare Advantage plan. And once you're a member, you have a premium, and your premium options include receiving a bill monthly, having it done by electronic transfer, which are those savings or checking account withdrawals, a credit card. We accept the Discover card, MasterCard, or Visa, or it could be automatically deducted from your monthly Social Security or your Railroad Retirement Board benefit check. Please keep in mind that if you have a late enrollment penalty, the amount will be added to the amount that you pay for your premium each month. Now here's a list of the resources and contact information that you can use to get more information. Medicare is 1-800-MEDICARE, which is 1-800-633-4227. And Medicare.gov has a wonderful website that you may want to check. It has an interactive tool that provides you with a lot of information about the different plans and the services that Medicare will cover. You can also enroll in Part B at Medicare.gov if you've not done that yet. Social Security Administration is 1-800-772-1213, and that's at SSA.gov. Now, you may also want to contact the Massachusetts Medicaid office at 1-800-841-2900 at mass.gov. They have a program called Prescription Advantage, which is a program for people that have high prescription drug costs, and it might be a good resource for you to get some assistance with paying for those medications. And I've listed the SHINE program, which is serving the health insurance needs of everyone, at 1-800-243-4636. And they are the volunteers you'll find at the Council on Aging, the senior centers in your community. They're currently available by telephone. The senior centers are not yet open because of the pandemic, and you may talk with them about various health issues and about the programs that are available to you, such as the Prescription Advantage that I've just discussed, and they will help you with any applications and things like that. And finally, this is the information for the Fallon Health Medicare sales team. We are at 1-888-377-1980. You can reach us Monday through Friday from 8 a.m. to 5 p.m. And you can also go to our website, fallonhealth.org/Medicare. We'll be happy to send out any information that you may require. So please give us a call or request that through our website. And finally, Fallon Health is an HMO plan with a Medicare contract. Enrollment in Fallon Health depends on contract renewal. I want to thank you for joining this program today. And again, please contact us at Fallon Health, and we're happy to help you with your Medicare needs.